before speaking. To start this webinar, let us pause for a while as we ask for guidance by listening to the prayer, and this will be followed by the national anthem and the AME hymn.
In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Angel of God's light, whom God sends as a companion for me on earth, protect me from the snares of the devil, and help me to walk always as a child of God, my Creator. Angel of God's truth, whose perfect knowledge serves what is true, protect me from deceits and temptations. Help me to know the truth, and always to live the truth. Angel of God's love, who praises Jesus Christ, the only Son of God, who sacrificed his life for love of us, sustain me as I learn the ways of divine love, of sacrificial generosity, of meekness and lowliness of heart. Thank you, my heavenly friend, for your watchful care. At the moment of my death, bring me to heaven, where the one true God, who is light, truth and love, lives and reigns forever and ever. Amen.
Bayang magiliw, perlas ng silanganan, alab ng puso, sa dibdib mo'y buhay. Lupang hinirang, duyan ka ng magiting, sa manlulupig, di ka pasisiil. Sa dagat at bundok, sa simoy at sa langit mong bughaw, may dilagang tula at awit sa paglayang minamahal. Ang kislap ng watawat mo'y tagumpay na nagniningning. Ang bituin at araw niya kailan pa may di magdidilim. Lupa ng araw ng walhati pagsinta, buhay ay langit sa piling mo. Aming ligaya na pag may mga api ang mamatay ng dahil sa'yo.
What better way to start the day or to formally start this webinar? Allow me to introduce, and it is indeed a great pleasure to introduce Mr. Nicolas Lianio, the Student Affairs Officer, for his opening remarks.
Thank you very much, Mike, for that sound introduction. Good morning to everybody. And it gives us great pleasure from the Office of the Student Affairs to acknowledge first our school director, Mrs. Raquel Cecilia Aschua, and the different department heads and coordinators together with their staff and members. Our partner institution in bringing this activity into reality, the Philippine Nurses Association, headed by their president, Ms. Jesusa Magno, and the board of directors, Mr. Mike Kalipayan and Dora Pongos. And the rest of the unsung heroes are the members of the Philippine Nurses Association. And we also like to acknowledge our resource person, Ms. Winnie C. Dorego, and acknowledgement and at the same time our warm and heartfelt thanks to Miss Mercy Gay Dadulia Elvina, our department coordinator, and the members of the Allied Health Sciences of ACLC College, and also to the members of the Office of the Student Affairs. Good morning to everybody. Um, this activity is somewhat in relation to the pressing problems that our students are facing right now. Um, the pandemic has brought a lot of challenges, and one of those challenges that are being faced by our students right now are the mental challenges of staying at home, not interacting, not being able to socialize with other people. So that really brings stress to them, and what better way to address that and by asking expert advices and at the same time expertise coming from people who know more about it, and giving an insight, and at the same time sharing those insights to our students so that it will help them in contending with the different problems that they're facing in their homes and at the same time wherever they are right now. So, with that, the Office of the Student Affairs would like to welcome everybody to this activity, and our hopes that all of the inputs can be used in order to improve our lives and at the same time our conditions right now with the pandemic. We are hoping for the face to face to be um, in place again, but unfortunately, with the variants and at the same time, what's happening with the pandemic, it's going to be, I think, a longer period. So, this activity will help our students a lot. So, thank you very much to everybody, and may God bless us all.
Thank you very much for that insightful words you have shared with us, Sir Nicholas. Now, to introduce our speaker this morning, we have our active and supportive nurse supervisor or assistant chief nurse from Tacloban City Hospital, and one of the member of the board member of the Philippine Nurses Association North Leyte Chapter. Ladies and gentlemen, Mrs. Rodora C. Pongos.
Okay. Thank you, Sir Mike. Magandang buhay and a pleasant morning to everyone. Our resource speaker for today, she is a nurse by profession, a graduate and Masters of Arts in Nursing. She is currently working at Department of Health, Eastern Visayas Center for Health Development, Palo Leyte, with a permanent position of Nurse 5 from 2013 to present. Her field of study is on public health. She has an interest in research, to mention health programs in general health care, evaluation of capacity building in public health, and impact studies of health policies implementation. Our first speaker also is a professional experience and receives lots of honors and awards. She has been an academic coordinator and clinical instructor at San Scholastica's College of Nursing here in Tacloban City from 2003 to 2013, and then from 2013 to present. She is the health program manager of mental health development at Department of Health Eastern Visayas in Palo Leyte. And of course, she attended several international events. Allow me to enumerate the international events in June 2017. She attended the training on children's mental health at Chikawa City of Japan. On December 2018, of course, she attended in Kaohsiung City, Taiwan on international mental health. And last year, it was January 2020, she attended in India on program management course. And aside from that, she has a peer-reviewed publications, the three models of scaling up mental health care post-disaster, common challenges, intervention international journal, which was dated on May 2020 issue. Without further ado, ladies and gentlemen, it is my honor and privilege to introduce to you our very active, very competent resource speaker. A virtual round of applause, please, to Ma'am Weni Campos Dureto. Thank you. So, Ma'am Weni.
Ma'am, can you hear me?
Yes, ma'am.
Okay na po? Okay.
Yes,
Thank you very much for that kind introduction, Ma'am Rodora.
thank you, ma'am.
Damo nga salamat. And beforehand, I would like to thank the ACLC family for inviting me here and letting me share some of the things that are considered important nowadays, especially in the midst of this pandemic, and not only this time, but even during how do I say it, during normal times. And PNA also, thank you very much for thinking of me and thinking of mental health. Uh, Advocacy is truly one of the things that we need to focus on right now. And even if we still have some barriers, since we have limitations or restrictions in mobility, but thankfully, we have this platform where we can still connect with each other. So, uh, allow me to share my screen for the presentation. May I request the host to please allow me to have my screen shared. Okay, so can you see my screen now? You can just type Y if you can hear me audibly and you can see the screen clearly. Please type Y in the chat box. Okay, thank you very much for your response. And as I was saying, I have my apologies. I was not able to attend the previous lecture or previous webinar fully, but I had heard some snippets of it. And we had a very good speaker, excellent speaker earlier, Dr. Arlene Rosal. And one of the things that she mentioned was about promoting mental health through advocacy. And fortunately, that's my topic today. As what our host mentioned, you said something about, and Mamagno also informed me that I will be talking about why is it okay to not be okay. And at this time of the pandemic, it really is quite challenging for all of us in at all fronts. Everybody feels the challenge, everybody feels the pressure, everybody is stressed, so to speak, when we talk about our mental health. So before that, please allow me to just give you to share with you what mental health is all about. Because for some people, when we ask them, when we go around and ask them what they understand of mental health, they automatically equate it with mental illness. Like when we ask them how do you see mental health? What is mental health to you? And they usually answer us, ay ma'am, ang mga lurong ada ito. Or ma'am, yung mga taong grasa. Those things are partly correct, but that is not what mental health is all about. Mental health has a more comprehensive definition. And I would like to share this. This is a definition from the World Health Organization. Mental health is actually a state of well being in which a person realizes her own capabilities. What I will be mentioning is are the criteria for a person to be called mentally healthy. So the person realizes her capabilities. She knows her strength, weaknesses. She knows the truth behind what she is, and she somehow have an understanding on why that person behaves this way or that way. The second criteria is for a person to be called mentally healthy, that person copes with the normal stresses of life. And I think that is one of the topics that was also discussed extensively um, earlier. But then, with your permission, I would also like to talk more about coping later in our discussion. And the third is that person works productively and fruitfully. So, people who have automatically when we think of work productively and fruitfully we think of those people who have jobs or who have some sort of a livelihood, but that's not what it entails. It also entails those people who are even staying at home, but they have their own task at home. So let's say, for example, a father who is not working but who is working at home, like tending to her family, taking care of the children, making sure that everything is well cared for, that's also working productively and thoughtfully. What about the children? See, the children don't have work also. But if we look at this, they can also be regarded as working productively and fruitfully if they go to school. But in our case now, since we have no face-to-face contact in schools, if they, for instance, accomplish their modules or attends classes in other platforms like virtual platforms. And last but not the least, a person who is mentally healthy makes contribution to the community. May naiaambag ka na kabutihan sa komunidad. It may be in small ways or big ways, depende, as long as you feel that you share what you have with the community, it it's okay. So let us look at our environment. Let us look at the statistics, the data. Why is it that we need to take care of our mental health? There was a study made in 2006 by the Department of Health Bureau of Epidemiology. They studied 20 government agencies in Metro Manila. And what did they found out? They found out that 32% of employees have reported experiencing mental health problems at least once in their lifetime. So, meaning to say, this now will connote that people who have mental health problems are not only people we see in the streets, people whom we see having violent reactions or violent tendencies. Because there are people who have mental health problems and they are suffering silently. So you cannot imagine that, 32% of employees reporting having some mental health problems. And what about in schools? Although these figures are really from the Philippine setting, it has been said that the current state of mental health care for children right now is considered as a public crisis. We have heard reports last year or the year before that of suicide cases occurring in children and in young adults. And it's quite alarming. Why? Because even in our region, in Eastern Visayas, for the year, we have a reported case of 16 cases for this year, ha? And that's only reported. There are other cases which are not really which are underreported because for one to be considered as a suicide case, there has to be some thorough investigation for that. So even if we are among the regions who have lower cases of suicide, still it's alarming. Why? Because it's still a number. One life lost is still a life lost. And for children and young adults, and even all throughout the lifespan, suicide or death by suicide is, how do we call it? It's sayang kumbaga. It's a life lost, and you can just imagine the potential that that person has if somebody could have helped him overcome uh, committing suicide. Approximately 21 of children and adolescents within the ages of 9 to 17 have a diagnosable mental or addictive disorder that causes minimal functional impairment. So, in the Philippines, we may not have this high a number, but this is a global number. So, meaning to say, with the rate that we have now with the suicide cases and with the consultations that we have reported in the different mental health facilities in the region, this can be true with us also. So, why is it very important to look at mental health, especially in schools? We already have in a law passed in the Philippines. It's the Republic Act 11036. It's the mental health law. And in that law, it is stated that mental health should be given priority in the community, in the workplace, and in schools. That's why we are in close partnerships with the Department of Education and the Commission on Higher Education, as well as the different state universities, private universities, and colleges here in the region to advocate mental health. Why is this so? Why do we prioritize mental health in schools? Because before the pandemic, the children and adolescents spends a third of their day in their workplace or they spend their day in schools. We never know. Maybe COVID will be over in a month or in a year or 5 years. But if it if the education system returns to normal, this will again be applicable. And when the child or when the person stays in school more, it holds potential stressors for the individual as he needs to establish himself in his studies and co-curricular activities. And even with the uh, modular and other methodology of instruction that we are having now, it's still the same because our students are being graded. Tama po ba ako? Meron silang may pinapagawa sila and then this needs to be accomplished and then they still need to pass the examinations, the tests, and then they are graded. They will learn later on if they have passed or failed. And unfortunately, failure in schools tends to devalue an individual's self-esteem, which contributes more to the person's feeling of being unworthy. Now, March 2020 heralded a new era because at that point in time, President Duterte declared COVID-19 pandemic in the Philippines. So, with the help of the Interagency Standing Committee, this is a group for mental health and psychosocial support organizations globally. They um, they studied and drafted and finalized some of the things that will make us understand the status of mental health and psychosocial aspects of the people experiencing the COVID-19 pandemic. And what is this? They said that although stress is common, because we encounter stress every now and then, even before the pandemic, every day of our life we have stressors. But the stressors may be a eustress or something that has a positive effect on us, or the stressor may be a de-stress or a stimulus which creates a negative response in us. But whichever, stress is common. And how much more for the pandemic how much more today wherein we are in the middle of the pandemic or we are in a pandemic. So, may dumagdag pa sa mga stressor na nafi-feel na natin dati pa. So, what are these pandagdag stressors during the COVID-19? First of all, the WHO identified that one of the pandagdag stressors during this time is rumors or are rumors and misinformation, especially in the social media. The social media actually is very good because it helps us be in contact with each other. It's very facilitative in terms of communicating or in communication. But the downside of that is that in social media, sometimes the facts are being shared or some information, I would not say the facts, some information are being shared even without it being verified first. That's why when we have these rumors and misinformation, it aggravates the feeling of stress or it adds more stress to what we are already feeling or experiencing. Like, for example, the rumors about the vaccine. There are so many rumors going around now. And sometimes these rumors are baseless. Or, of course, because since it's a rumor, it's baseless. And we need to be very vigilant of that thing. Whenever I think I hope that you are familiar with the BIDA solution that DOH is advocating. BIDA solution is actually saying that the answer is in our own hands, or the solution in combating COVID-19 is actually within our own hands also. We have to contribute to the solution. What is this BIDA? Actually, the first letter connotes the different meanings. Bida means B, standing for bawal ang walang mask. So, dapat talaga nakamask. I stands for isanitize ang kamay at ang or with the help of soap and water or alcohol. D means dumistansya ng 1 metro or more than a meter distance, 2 meters even. And A stands for alamin ang wastong informasyon. And this BIDA solution now is one of the ways where we can combat or we can displace all the rumors and misinformation that we have that is around us, which aggravates the tension. Since I am invited by an academic institution, I would like to emphasize this that one of the major stressors that we are undergoing right now, especially for both the students, the teachers, and the staff alike, is the closure of schools and the children's activity spaces. As what I have mentioned earlier, it has been said that teachers, students, and other non teaching staff usually spend a third of their day in schools. That's the normal. But then again, it's the new normal now is not to be in schools. That's why when this started, it really created, when the closure of schools started, it really created some very high stress levels, especially in children. Yung iba nga na children, okay lang sa kanila. I would like to speak from my experience. My children were happy when when it was announced that there will be no school or no going to school. School is suspended for indefinitely. But after a month, hinahanap-hanap na nila yung mga kaeskwela nila, yung mga teachers nila, at mismo yung schools nila. They are looking forward now to the face-to-face interaction. And that in itself is a source of stress. Kaya hindi po pwedeng sabihin na yung nai-stress lang ngayon ay yung mga adults lang. Pati po yung mga kabataan, they are also stressed out. Other sources of stress as identified by the IASC is the travel restriction, hanggang drawing na lang tayo ngayon, possibility or actual physical isolation and quarantine, deterioration of trust in government agencies, meron din yan, avoidance of health facilities, as you will notice, maybe even among yourselves, bawal na po ngayon talaga ang magkasakit. Sabi nga ng joke, mautot ka na lang, wag ka lang umubo. So, dati-rati pag halimbawa a little fever, a little cough and colds, people would be in the hospital having their medical consultations. But now, with all the restrictions that we have, with all the precautions that we are practicing, konti na lang yung nagpupunta sa health facilities. And we also need to think about those people who have pre-existing health conditions. Like for example, yung mga may diabetes, may hypertension, and of course, yung mga there are also people who are over-vigilant na konting ubo lang na what do you call, na prapraning na sila, overreaction to these things. So, I would like to tell you something about ano pa ang ginagawa natin pag may nai-stress tayo. Ano ba? I would like to talk about the fight or flight theory of, I think it's Hans Selye, if I'm not mistaken. So minsan, pag may mga challenges na na-encounter natin, there are two reactions. Sometimes nga, nowadays, I have read that there are already three reactions. Yung una is fight. So you encounter, you look at the problem head on. The second is you escape or you flight. You go away from the problem. And the third one, which is not here in the slide, is that sometimes people would be frozen. Parang si Elsa at si Anna lang. Walang reaction. And actually, those are normal. So, let me just go through with the many responses to stress. So, by the way, before I proceed, I would like to say that when you have these feelings of stress, think of it as a normal reaction to an abnormal situation. Because right now, we are in an abnormal situation. So, kaya sinasabi natin na minsan yung mga feelings na ganyan, it's okay. It's okay. There's no, how do you call it? There's no, I would not like to say it harm, because some of the reactions that we go through should be time limited din naman. Huwag naman yung matagal na. But then again, that's, as I've said, these reactions are normal in an abnormal situation. So, ano-ano po ang mga responses natin sa stress? It can be physical responses. Do you feel this when you are stressed? Like for example, may loss of energy ka, biglang nagpapalpitate ka, or sometimes pagod ka na lang lagi. Or sometimes laging masakit ang ulo mo na hindi mo naman alam why you experience frequent headache. Well, that's a physical response to stress. Stress can also produce emotional responses like fear, denial, anger, acceptance, maybe kung nandyan na. So, these are emotional responses. Kaya minsan, wag na tayong magtataka pag yung iba sabi nga nila overacting na daw sila. Na hindi lagi na lang nagla-Lysol, lagi na kahit nasa labas naka-gloves, all these things. These are just normal
Pagkatid
reactions
ako webinar.
because each one of us is unique. I would like to say that again. Each one of us is unique. There are different responses to different stressors by different individuals. So it's not to say that this problem or this stressor is small, because that may be small to you. The problem may be small to you, but to the other person, it's already a major problem for her or for him. So again, I would like to stress that. Aside from physical and emotional responses, stress can also produce behavioral responses. Like for example, baka ngayon, kasi lagi na lang nasa bahay, lagi na lang naiirita. And there is some reports today that globally it has been found out in a survey that domestic violence have increased in terms of cases of abuse. Kaya po siguro ito na yung nagiging abnormal naman na response sa stress ng COVID. Yung being cooped up at home for long periods of time. Behavioral response may be in the form of being accident prone or being absent, laging absent. Yun ang isang response din nun. By the way, are you familiar with the word presentism? Please type Y if you have heard of the response called presentism. If or N if di pa ninyo naririnig po kung ano ang presentism. Alam niyo po ba kung ano ang presentism? Okay. Mga N kayo, sir, ano? But alam niyo po kung ano yung absenteeism, of course, di ba? Being absent at work. Presenteeism is actually a response also sa stress. Ano po ang presenteeism? Presenteeism is when you are in the particular area where you are supposed to be at, but your mind is elsewhere. Okay? So, halimbawa, I don't know if you have encountered a student or somebody na pumapasok siya, present siya, pero wala siyang output. Kasi malayo yung iniisip niya. Wala siyang focus. The focus is not in the job or at the work at hand. Ito po yung tinatawag na presentism. This is also a response to stress. So, napakadaling sabihin po I know that you have heard of this, that they said, 'di ba, leave your worries, your problems at home, do not bring it to work, and vice versa. But human as we are, sometimes we cannot really separate our two entities. Kasi we work as a whole. As holistic po tayo. So minsan di natin nadadala pa din natin yung mga problema natin sa bahay, sa school, or sa work. Spiritual response may as a response to stress can be in the form of blaming God for what happened, attributing this pandemic to God, like parusa ng Diyos, or resignation and acceptance, and other responses directing one's anger to God. Spiritual naman po ito. Okay. So, we now go to the different coping styles. At kagaya nga po ng sinabi ko kanina, these are the things that we encounter every day. Stress is there from the minute that we open our eyes in the morning up to the time that we close our eyes to sleep. Nandyan po ang stress. Pero, sabi nga nila, you cope with it. You adjust to whatever life is throwing at you. 'Di ba? Every day, kahit pagising mo, walang tubig. Nawawala yung tsinelas mo. Basa pa pala yung dapat mo isuot. Basa pa yung uniform mo. So when you encounter these problems, these challenges, do you just sit there and cry? Or do you do something about it? When you do something about it, then that's coping. And I would like to go back again. Each one of us is unique. Each one of us has our own coping style or coping strategy. When you face problems, like for example, not being able to attend school, not being able to connect with the internet, kasi may online synchronized discussion kayo ngayon. Pag may ginagawa ka doon, you just it just means that you are coping with the problem that you have. And I would now like to ask you, if you have problems like that, what do you do to cope? Ano po yung ginagawa ninyo?
Pray.
Ayan, nakakita na dyan mama, no? Because praying is the universal coping. Halos lahat po ng, we have been very active in the psychosocial scene post-Yolanda. And even after even after Yolanda, we have been deployed to the different disaster areas here in the Philippines. Kasi yung group po namin sa mental health and psychosocial support, kung nasaan po yung disaster at emergency, nandoon po kami, pinupuntahan po namin. Yung iba is going away, kami naman po pumupunta pa. Because we see and we recognize that mental health really is one of the needs that kailangan. And kagaya nga po ng sinasabi ko, when we go around these places, praying is usually the coping mechanism that they would identify. But that's not only praying. We have other coping mechanism. Can you look at the, is the screen clear? So, can I ask for audience participation at this time? Among those listed here in the screen, ano po yung mga ginagawa nyo na coping? Sige nga po. What are the coping styles that you can see or that maseselect po ninyo among those na written here? Pag wala naman po dyan, please feel free to just put it in the chat box. Cry, sleep, spending time with friends, working, eating and sleeping, music and baking. Wow. Cry, music, gaming, music, sports, warm bath, meditation, like yoga, maybe, no? Sleep and gaming. Daming music ha. Marami pala sa mga taga-ACLC ang mga musically inclined. Kaya maganda yung ano nyo kanina. Maganda yung hymn nyo. Gaming, exercise, of course. Marami nang nagba-biking dito. Praying, acceptance, laughing, humor can be one of the ways to cope with stress. walking or exercise or just plain walking and looking at the beauty of the surroundings, analyzing, sleep, eat, laugh, parang anong tawag doon ulit? Yung love, pray, eat, love, pray, eat, pray, love ni Julia Roberts, praying, crying sometimes. So, as we look into these slides, what do you see? These are coping, common coping strategies. Look at it. And let me ask you now, are all of these positive coping strategies? Or are there strategies here that can sometimes do more harm than good? As you will notice, we have strategies here like smoke, drinking. Pero yung drinking sometimes ni Sir, okay lang. As long as you drink moderately. At yung drinking naman po ay hindi sa gitna ng liquor ban. Okay, so smoke. Sometimes po, in the Department of Health, we really are against smoking. So anti-smoking pa. For those who have already started smoking, who are smokers, please stop. For those who have not tried it, don't start. Meron dito, sex. Oo. Safe sex po tayo kung ito po yung ginagawa. But of course, premarital sex is still not encouraged. Drinking is also, as I've said, should be confined to social drinking only. A glass or two is okay. So these are the different common coping strategies which are both positive and negative. So we would like to ask you to please embrace those coping strategies that have been most helpful to you and not detrimental in the long run. Kasi ito po yung nangyayari po pag halimbawa po nag-i-smoke ka. For the moment siguro you are relieved, but after a few years, you develop some health problems out of that. Yung shopping din. Sino dito ang 11-11, 12-12? Minsan po kasi retail therapy is good, but if we cannot afford it, ganun din, in the long run, mas marami po tayong magiging problema. Kasi wala na po tayong pambayad. Okay. So, accept what you are and eto po yung sinasabi ko lagi sa atin, reminders to all of us that each one of us is unique. In the DOH po, eto po yung mga tips namin. So, tinatawag po namin itong isang dosenang S, iwas stress. So, let us smile. Smile po tayo, but only if you want to smile. If you don't want to smile because something is bothering you, then that's okay. Take a little rest or siesta. Siesta is, I think, in the strictest sense of the word, siesta is sleeping after eating lunch. Tama po ba? Or afternoon nap. Pero, siesta can also be sleeping. Sleeps a night. Okay. Just like to, as sabi po kasi nila, we need to sleep as adults at least 5 to 6 hours a day. 5 to 6 hours a day po ba ang sleep nyo? Nakaka 5 to 6 hours po ba kayo? Type Y or
Stop.
N? Yes. No. So, hindi ka ma'am nakaka-sleep. Yes. So 5 to 6 hours a day. Kasi yung 5 to 6 hours daw po, yun yung adequate time for our body to be rejuvenated, for our cells to be working and repairing itself. So, if you cannot sleep, hindi po regular yung sleep nyo. By the way ha, yung 5 to 6 hours of sleep, it's sleep that is uninterrupted. Uninterrupted. Ibig sabihin, yung tuloy-tuloy na 5 to 6 hours. Kasi, pag nakaka-sleep kayo ng 5 to 6 hours, pero every once in a while naman po, every hour, nagigising kayo, hindi po yan restful. So, dapat 5 to 6 hours. Sports is also one. So, ano yung mga sports nyo? Sige nga. Do you have sports now or do you exercise regularly? Ano?
Volleyball.
Volleyball. Wow. Sana all ha, nakakag-volleyball. Soccer. Yeah, Zumba is good. Chess, more of a mind sport. Si Sir Mark, no ma'am na, wala na siyang sport. Anybody of you who are into biking? Kasi yun yung marami kong nakikita dito sa government center. Maraming nagbabike. Ang gaganda pa po ng mga bike nila. So yes, biking is one of the newly discovered sports that we have now. So pwede din po yon. Or walking can also be good. Just going around your neighborhood. Make sure that you don't have close contacts, na hindi po kayo dumistansya din palagi. Magba-bike pa lang si ma'am. So, yon. Enjoy it. Okay. That's sports. Socials. Kasi wala na tayong di ba? Nakapag-Christmas party po ba kayo last year? Did you have your Christmas party? Yung totoo, charot. Hindi na, di ba? Kaya po, tama si Ma'am Raquel. Sabi ni Ma'am Chua, socialization can be done still virtually. I know it's not the same. But then again, we have to think of our safety first. Kaya po, much as I'd like to be with you now doing sana face-to-face interaction with you, we are limited to this, but I hope that we can see each other. Because attending attending webinars can also be a form of socialization. How are you with your friends? Do you still keep in contact with them? Do you still have conversations with friends? Sometimes, um, yeah, group chats. Yan ang usong-uso ngayon, ano. So, through other platforms, we can communicate through Messenger, Viber, chats, whatever, emails, or video calls. And kahit yung call natin or text messages, that will be very lovely if you still keep in contact with your family and friends. How about scheduling? Ito yung isang S eh. Kasi minsan, pag hindi organized po yung trabaho natin, hindi na late tayo, kulang ang submission natin, nakakadagdag stress po yon. So, let us please schedule our activities. What is speak to me? Speak to me is having someone who to talk to or to confide with. Kasi nga, kagaya kanina, during the discussion of Dr. Rosal, sabi niya, minsan, ang kailangan lang talaga ng tao is somebody to talk to. Somebody who will empathize with the person. Somebody who will understand. Speak to me doesn't mean that you have to be a guidance counselor. It doesn't mean that you need to be ready with your solutions whenever some people would share with you their problems. It's not that. Speaking, letting them speak, and you listening to them is a help by itself. You are already helping them. So, for those who are listening to friends talk about their problems, continue doing that. Kahit wala po kayong sinasabi, nakakatulong po kayo. Spirituality is also, I think it was already discussed, yung prayers natin. Sounds and songs, this was also identified. Marami tayo ang nag-identify ng music kanina as one of our coping. Because it's sounds and songs are actually very calming, di ba? And then the songs that we sometimes play varies with the moods that we are in. Self-awareness. If you remember during our mental health definition in the first slide, it has been said that for a person to be regarded as a person who is mentally healthy, the person has to know himself. What is his strengths? What is his weaknesses? So that when he knows himself, he will be able to realize his full potential. So be aware of yourself. Kilalanin mo po yung sarili ninyo. Kilalanin niyo po. You can do this by just introspecting, writing in a journal, kahit ano. And it cannot be done in a small period of time. It's a long process. So, araw-araw, you never know. You might be discovering something about yourself. Diri nga yan ako pwede ini magsugad. Kasi madali ako masina kung amo ini an akon stimulus, amo ini an akon stressor. Those things. Stress debriefing, although stress debriefing is not the norm now, we call it more as psychosocial support. This can be in a form of seeking professional help. For those friends who have been listening to their friends' outpourings and you think that uh, you cannot take it na, parang para sa'yo mabigat na din, and you feel that that person or your friend needs more professional care, so please do not hesitate. Later on, I will give you the numbers to call if in case you have those. But I believe Dr. Rosal already gave you the number sa EVRMC. Sensation techniques are like, for example, just tapping a person's shoulders to say that he is doing well. But of course, that's not applicable right now. So you tap yourself on the shoulders for a job well done. Sige nga, let's tap ourselves in the shoulder na, yes, we survived 2020. Yon. And last but certainly not the least, sensible diet and exercise. Kain po tayo ng nutritious foods. Although, ngayon nga dahil po tayo ay naka-quarantine minsan or we are confined in our homes, sometimes hindi po natin namamalayan na napaparami na po pala ang pagkain, di ba? Who among you here have gained weight from March to December of last year? Sino po yung nag-gain weight? Sige nga, meron ba ditong magsasabing yes? Kasi ako yes na yes na. May nag-gain weight ba? Yes, aha. Talaga. Oo, nag-gain weight din ako. So, it's okay. We just need to have exercise. Yan ang nakakabit dyan. Sensible diet and exercise. So, please, let us also take care of ourselves. And that's the 12 S's. Let me proceed. Ito po yung ating mga red flags. Kanina, yung mga responses to stress, as I've said, they are normal reactions to an abnormal situations. But if we see these red flags, then that's the time po siguro that we need to seek others for help. Like for our children, some of you may have children in the home. Kung hindi naman refuse to go to school, kasi walang school ngayon, baka po ayaw nila mag-module, hindi sila nagmo-module. Oo. And then sometimes as parents, automatically, ang interpretation natin is tinatamad yung mga bata. Baka hindi po tinatamad. Maybe there are other reasons behind why the child is not accomplishing or doing well in school. Feeling sick lagi, worried that bad things will happen to the people they love. For teenagers naman, these are common, but sometimes if this gets very severe or this gets severe, we have to act on it. So, common for teenagers to feel that they are misunderstood, moody sometimes, kagaya sinabi kanina, may usahay, gusto mag-usahan la, but if, for instance, this progresses to something mas serious na, like for example, hindi na siya kumakain, hindi na natutulog, wala nang self-care, hindi na naliligo, other things that the person, you notice na dati that person enjoys K-drama, pero ngayon ayaw na niya ng K-drama, ayaw na niyang manood, nagmumukmuk na lang siya, then that is something that is to be recognized, and that's a warning sign that something might be wrong with the person. Feeling sad or despair for no reason at all or with a reason, pwede din yon. Kasi baka ang tao ay going to depression na. Kaya these red flags should be observed. If these red flags are observed, please do not hesitate to seek for professional help. What to do? Talk with a person. Istoryahi. Istoryahi. Hinmaupay, hinmahinahon. If that person will not talk to you, then ask that person, hino para haimo iton mas makaka-open up ka? Kundi riha akon, but of course, do not take it personally because sabi ko nga, baka hindi ikaw ang gustong kausap. So, maybe she can talk to a friend, she can talk to her aunt, or somebody in the family na mas comfortable siya makipag-usap. Offer your support and show your love and concern. There may be times that that person will not want to talk with you at that particular moment in time. He is not open to sharing with you yet. But please tell the person, okay, I will be right here. If you are ready to talk, then call me. And consider an evaluation from a mental health professional if you think that the problem was not resolved. So these are the different facilities that we have. Kanina, we were lucky to have Dr. Rosal from EVRMC. So I think she already gave you her contact number as well as the schedule. We also have Schistosomiasis Research and Control Hospital in Palo. But right now, because of the pandemic, they are catering muna to their old patients. So wala pa po silang new ngayon na consultations. And please do not hesitate to go to your city health offices like Tacloban City Health Office and our rural health office kung saan man po kayo or kung saan po nakatira yung tao. We have mental health trained professionals sa mga sentro. Okay. So they are trained po to deliver basic mental health care services. Pag hindi na po nila kaya, like for example, the person needs referral, then that's the time that they will be referred to Eastern Visayas Regional Medical Center. So meantime, if you have referral, pwede po doon po muna sa Rural Health Office para po hindi sila muna magbiyahe to EVRMC. Okay? And we have a virtual platform. Kasi nga po hindi pa pwede ang face-to-face. We are limiting that for your safety and for the safety of the healthcare workers. We have opened 2 lines for texting and calling. This is for Globe and Smart. I think it's already flashed in your screen. So please free to give the numbers to your friends and family or to whomever you think that who needs somebody to talk to. Kahit ano po, kung kailangan ng kausap, meron po tayong 2 helpline. We call this the mental health helpline. So this is manned by mental health care professionals trained in mental health and psychosocial support. Hindi po ito pwede na kahit sino lang po ang magmaman ng mga phone numbers. So in case that the person who called needs referral, we refer her or him to a psychiatrist na meron din pong line or phone number para doon sa psychiatrist na yon. Our schedule is Monday to Friday, 8 to 5, pero pag emergency situation, you may call or text us on Saturday and Sunday. And even beyond office hours. Pag halimbawa, nakikita ninyo that it really needs emergent intervention, the person is already causing harm to himself or to others, pwede po, wag na pong tumawag muna. Diretso na po tayo sa mga facilities that we have mentioned earlier. This one po. Okay? And ano ito? Lastly, you recognize this? You recognize this picture? Na-mention po ito kanina ni Sir. This is the Korean drama na It's Okay to Not Be Okay. Ito po yung Korean drama kanina. And it's really okay to not be okay. Because if you're sad, that's okay. If you're sad. If you're hopeful, that's okay. If you're angry and hungry, that's okay. If you are tired and stressed, that's okay. If you're just okay, that's also okay. Because sometimes we are allowed to fall apart so that we can find ourselves and pick up the pieces and begin again. Ganun po yun. And there is nothing in nature that blooms all year long. So don't expect yourself to do so either. There might be on days and off days. And what we need to do is we need to understand that these things happen. And that when these things happen, we need to find it in ourselves to, as I've said, pick up the pieces and start again. So I think that's the last of my slide. Damo nga salamat sa iyo, han iyo pamati. Thank you very much.
Thank you very much, Mom Winnie, for all you have shared with us. And I'm quite sure that everybody was able to grasp the entire idea and hope your students, or the students rather, will slowly inculcate in their systems of what they heard from you. And now we will open the lineup for the open forum. And I hope and I am encouraging everybody to please raise any questions, clarifications, or query to our speaker who is now standing by. We have 55 participants. This is quite a number actually for an attendees, especially from ACL students. And I'm very thankful for all your participations. If you're a bit hesitant to raise your hands, you may write your questions or clarifications in the chat box. We will read it for you.
Hi, Ma'am Winnie. Hello.
Hello po, sir. Good
Yeah.
afternoon.
Yeah, good afternoon, ma'am. I'd just like to commend you for that wonderful discussion. Maybe ask also your presentation so that in the future, if we will be having certain discussions internally, we can probably use it for for consumption la siguro.
Yes,
Ah,
sir.
ah.
I will email the presentation po to you.
Thank you very much, ma'am. Thank
Just
you.
give me the email ad where I will send the
Uh,
presentation.
okay, thank you very much, ma'am.
Thank you very much, sir. Ma'am, do we have any other questions, Curry, from the students? We have 52 participants. How do I know if I am just sad or I have a mental illness? This is from Jenelisa Arguelles.
Okay. So there is a very thin line between being sad and being depressed. So we all at one time have felt sad in our life, ba? And sadness can be triggered by loss. Sadness can be triggered by um, disappointments, frustrations in life. So the triggers may not matter because, of course, I recognize that fact that there are really triggers that are more major and more minor. So, but the thing is, how do we know that we are already veering off from what is considered as normal? First and foremost, if we are already hurting ourselves or hurting others. Hurting ourselves or hurting others may be in the form of physical injury or self injury, and hurting others is also the same way. But it's not confined to hurting ourselves na physical injury lang. It can also be emotional abuse. And um, it can also be one of the signs that we already have some problems. It's not actually an illness yet, but it's we recognize that it's already a problem when we are already failing to do our activities of daily living, which is important for us to survive. And what are these? These are, for example, eating, sleeping, exercise. These are activities of daily living. And if that person do not do it anymore, then that can be a way to self-destruction. Another sign wherein a person is already having mental health, already having a mental health problem is inability to focus on the task at hand. So when one has an inability to focus, sometimes di na din siya makapag-study, hindi siya makapagtrabaho. And sometimes focus will also be focus on what the person or what the person has been previously doing to that gives him joy. Hindi na po niya makita or hindi na niya maramdaman yung joy na nakukuha niya or hindi na siya na sasayahan, nasisiyahan sa mga dati niyang ginagawa. So, and these things can also be there can also be a difference in terms naman po kung kailan nyo or hanggang kailan nyo na nararamdaman yung mga sinabi ko. Of course, those are not the only things that are the signs and symptoms of a mental health problem. Marami pa pong iba. One of the things that hindi ko na mention is looking at things unrealistically. Like for example, paranoia, delusions, and such. But I'm going to talk about one of the common lang, yung depression. Kasi we might feel sad for a time, but that sadness is actually parang limited lang po siya in terms of experiencing it sa time. Pero it can now be a problem when you felt those things that I have mentioned kanina na more than 2 weeks na. Pag halimbawa, hindi ka na makatulog yung tulog nga is even 4 days na wala kang tulog, that's already a sign of, that's a cause of alarm. So you really need to talk to somebody and seek professional help. So as I've said, there is a very thin line between sanity and insanity. And what we need to do as a person is to be self-aware. We need to know ourselves. So that nakikita po natin kung ito ba yung ginagawa ko, tama pa ba ito or hindi na? Am I harming myself when I do this? And that self-awareness will come in handy kung meron tayong malaking dagot na experience. So I hope I answered your question.
We have plenty of questions here po, ma'am. How do I know if someone has a health or a mental health problem?
Yun po yung sinabi ko sa inyo kanina. We know that a person has a mental health problem if he or she cannot do the things that he has been doing anymore na yung na-observe mo sa kanya na may mga changes na, especially in terms of self-care. Sir, a moment ha, kasi I need to charge my laptop.
Okay po, sige po, noted po, ma'am. For the meanwhile, may I request everybody to fill out the survey form provided in the link. The survey will assess the objective if it was met, and this will serve as a guide for future webinar. I believe the link was already provided in the chat box. Don't worry, I'm taking down all down notes of your questions. It's a bit overwhelming. Dami na po. Pero anyway, as much as possible, I will address this to Ma'am Winnie. Again, we have the survey form. Please fill out lang muna.
Okay, sir, sorry for that. So,
Di, okay lang po. May I read, I have a red flag here. I have an experience po dati, an anxiety and depression po. 3 years ago, nagpa-psychiatrist na po ako. Then na-triggered na naman po until I cut my arm to relieve me. This is the question po from Donalyn Palane.
Okay. So that is self-inflicting injury. And that's quite serious, Miss Donalyn. And first and foremost, I would like to, uh, I am honored. How do you call it? Honored ba yun? I, I, kasi it's not, you are very brave. That's what that's the words that I am looking for. Brave ka that you have chose this to divulge this information to us. And I recognize that. So this action is a cause of concern. So I would like you to, if you have time, if you want somebody to talk to, our office is open. You can call the mental health helpline. And if you need more help, if you think you need help, then we can refer you to somebody who can help you more. So thank you very much, Donalyn, for trusting us with this information. I hope I hope that you are okay now, and if not, then help is here. That's what we want to say.
Another question here po, ma'am. My question is, are drugs for therapy better for mental health conditions?
Um, there are many interventions for mental health problems. It can be pharmacologic, as what we have said. Medicines can help a person. It can be non-pharmacologic, like for example, therapies can work also. Um, Talking with a person can also help. Psychotherapy can also help. Family therapy can also help, especially if the problem is with the family and the source of support is the family. So there are many interventions that can be done to the person in the different stages of a management.
From Sheena Marie, how can we prevent shaming with having mental health problems po, ma'am?
Yeah, that's a very good question. Because mental health is still suffering from the stigma. As I have said in my first in my first few sentences that I have uttered here, when we think about mental health, people would usually automatically think mental health as something which is or equate it with mental illness. And that should not be the case. Mental health is a state of well-being. And just like health in general, parang physical health din po yan. That there are off days and on days. Like for example, a person may be having some cough and colds right now. And what do you do when you have cough and colds? Depends, di ba, on the severity. If it needs hospitalization, then kailangan mo magpa-hospitalize. Or kung kailangan lang ng water therapy and rest, then you do it. Mental health is also akin to that. It's like that. If you think that things are already too much to take on for you today, what do? You rest. If rest is not enough, then maybe you need to find or seek professional help. And that's where the problem begins. Kasi most people would not seek professional help because they think that when you see a psychiatrist or a psychologist, that is already tantamount to having a mental health illness. And that should not be the case. Because people should be able to seek help even if the problem is not considered as severe. Dapat meron po tayong mapupuntahan. Kahit kausap lang. Early intervention, prevention is still the key. Yun po yung gusto po sana nating baguhin na mindset. Let us not stick with the stigma that mental health is equal to mental illness, that mental illness is incurable, that we cannot help those who are mentally ill. That's not correct. Help is here. Help is available. You just need to look and see and find out who among us or within us are able to help. Kaya po, nagpapasalamat po kami in the DOH that we are invited to these gatherings and to these meetings because these are our avenues where we can advocate kung ano po talaga ang kailangan natin para maintindihan po natin kung ano po ang mental health. So, thank you again for inviting me and thank you for that question. I hope na with these webinars, with the seminars that we are having, this is already a multiplying effect. This multiplies the advocates count na mas marami po ang magkakaroon ng mas malawak na pag-uunawa at pag-intindi kung ano po ang lusog isip or mental health.
Do we have any other questions? I guess as I read all the questions here, na-answer naman po ni ni Ma'am Winnie. But I have here, can people get over mental illness without medication? Thank you.
Can people?
Get over mental illness without medication?
Yeah, it's possible. It's possible po that they can because as I have said, it's not cast in stone that for this particular mental illness, it has to be this medicine or this management alone. Sometimes it has to be a combination of these different management, but sometimes one of the management is enough for that person to be well.
I have an interesting question here from Francis Altar. What foods that improve our mental health?
I'm sorry.
What foods that improve our mental health?
What foods? Pagkaon?
From Francis po, Ma'am Francis Altar.
Okay. There are foods daw that contains happy substances. Oo. Like for example, I know of chocolates. Tama?
Yes,
Chocolates have these substances that when ingested, they sort of trigger your happy hormone. So that's one. And it depends on the person. Kasi meron naman pong iba na halimbawa po, the person is fond of eating tawag nun mga fast foods. And fast foods have may nakakonnote po or nakakonect po ang fast food na yon to a moment in the person's life na happy siya. Bawa, doon ang first date nila ng inggis niya or ng boyfriend or girlfriend niya. So, the food is connected with a happy memory. Pwede po yung ganon. And pwede din po, depende din po sa value ng tao. Like for example, vegetables. Vegetable may be a happy food to vegans. But it may not be a happy food to those who are fond of eating meat. Ganun lang po yun. Kung ano po yung I think it's more on the memory that is connected with that particular food.
Will you be
but I know in one of my researches that the kumbaga haaton ang harang
yes, ma'am?
chili.
Yes, ma'am.
Chili is said to have an antidepressant effect, and it's already studied, but I'm not sure. Makuri man kung ang depressed patient magkinaon na lalawatin harang, dirilot suga dito. But anyway, that's one of the those are things that I know of na nakaka-trigger hin happiness.
It's already 12:38. Can I ask the speaker if mag-entertain po pa kung may question po, ma'am? Or should we end this na po? We have 1, 2, 3, 4, 5, 6 questions in line po.
Okay, maybe last question na lang if you may, if you
Okay
will
po.
allow me.
Okay po.
Maybe I can eto na lang siya.
Sige po.
Last 3 questions dito that I can see in my screen.
Sige po.
First one is, do psychos know that they are psycho? I think what is meant by this question is, do people with mental health problem know that they have mental health problems? Yes. Sometimes they are aware of that. But then again, sometimes for other conditions, like for example, have you heard of antisocial mental health problems? Yung mga antisocial, minsan hindi nila alam that what they are doing is already outside the norm. So that's why, again, we go back to self-awareness. Second, nakaka-trigger po ba it stress para dumamo it imo pimples? Oo. Oo, nakaka-trigger daw kuno ito. Usa ito, that's one of the cause of stress. Cause of the pimples, sorry. Na nadamo hera kung stressed out ka. Not only pimples, pero I presume you also know that sometimes kung na-stress ka, nagpo-falling hair ka, nagkakataktak iti mo buhok, sa ito hiya, there are also many, napakapot kan iyo, manimo buhok, sir, also many physical responses to stress. So that's it. Another is, last question, why do some people choose to just take meds and no therapy? Maybe because therapy is not available. Only the medications are available. And I would like to say my salute to mental health professionals. Grabe, it's not like when we have our physical checkup lang, usahay paspasay la. In consultations with patients who have mental health problems, it takes a longer time. And it takes a lot of patience, understanding, and compassion. Because these consultations and this therapy might go on for hours. Kaya kailangan talagahin pasensya. And sometimes because of lack of people who can do this, amo ito ada nga, di rin nahira ng kakag-therapy. But ideally, the medications should be hand in hand with therapy. That's the ideal setup. I think that's the last question. I hope na-answer ko tanan. Na-justify ko an presentation, and I have more or less answered the questions that you have posed satisfactorily. So thank you for listening all.
Thank you very much, Mom Winnie, and I would like to thank all the students for posting your questions, and I hope we were able to read all of that. Ang iba waray na mabasa namon, pero we will be taking down notes to that.
Excuse me, can I also thank you, the host, the students, the staff, ACLC, for being such good participants. Grabe, 100% kamuha audience participation.
Yeah.
So, how much more kung face to face, mas
Yeah po.
magi-enjoy kita. Hopefully, next time we can do this uh, na face to face kita, magkikirigta kita, we will have some games and such, we will have fun.
Yeah.
Thank you for
This
being
is really
such good audiences.
this is really actually a very interesting topic. Anyway, as we wrap the day, it is right and proper as to give our due recognition to our speaker, Mom Winnie Dorego from DOH, for sharing her expertise and knowledge. May I call Mom Mercy Gay Elvina, the Department Coordinator for Allied Health Sciences Department, to award the certificate.
Good morning. Good noon, I mean. Okay. So, ACLC College of Tacloban, the Office of the Students Affairs, in partnership with the Philippine Nurses Association, North Leyte Chapter, awards this certificate of appreciation to Miss Winnie C. Durego, RN Man, for sharing her knowledge and expertise, being the resource speaker in the mental health awareness webinar with a theme of It's Okay Not to Be Okay via Zoom, given the 7th day of January 2021. Signed, Raquel Cecilia Estuva, MM, our school director, and Jesusa M. Magno, R.N. Man, the president of the Philippine Nurses Association North Leyte Chapter. And of course, um, I just want to extend my heartfelt gratitude to our convener. Another certificate of appreciation is awarded to the Philippine Nurses Association through its president, Mrs. Jesusa M. Magno, for for the valuable partnership in the conduct of mental health awareness webinar to our employees and students. Given the 7th day of January 2021, signed by our school director, Mrs. Raquel Cecilia S. Chua, MM. Thank you very much. Thank you very much, Ma'am Winnie, and of course the PNA through the President. Thank you so much. It is our pleasure to be our partner or our convener. Thank you.
Okay. We have now come to an end to this very important event, and I hope our participants, or the students rather, were able to grasp the idea, and hopefully what you have learned, you will inculcate this in your system. And I would like to call now Mom Raquel Cecilia Chua, the school director, to give her closing remarks.
Hello and good noon, everyone. Okay, so first and foremost, I would like to extend my gratitude to Miss Winnie Durego for enlightening us about mental health, and at the same time, as what you said, it's okay not to be okay. Oh, acknowledging what we feel is very important because that's what makes us human. And then I also would like to take this opportunity of thanking my dear students who participated in this activity. You know what? It's really difficult kasi ang Zoom kumakain yan ng napakalaking data. So they have to really uh, uh, put in something, no, for them to be able to join us. And thank you so much, my dear students. Some of them were not able to attend because there are some parts in the region na walang kuryente ngayon. Pahirapan ang signal, but we do understand. For those who are here, thank you so much. And for those who have shared very important details about themselves, ano, yes, uh, ako when I was looking at the message, sabi ko, it really took a great courage for this person to say, I gone through this and I'm still struggling, no? And may this also be a wake up call for our dear students that what you are feeling, if you are not sure, there are people who are willing to listen to you. And I hope that you have taken note of the numbers, because we also have here in school, we took down these numbers, because this is also a perfect time that uh, we will also help others in knowing that we have people who are there to listen and to hear us out. Hindi kayo nag-iisa, may mga taong na nakapaligid sa inyo. Even for you, my dear students, your teacher advisors are there, your teachers are there. And again, no, if you think, ay, even my coordinator, hindi ko siya ma-reach out, we have several Facebook pages and there are people who man it every day. Uh, I would want you to go to ACLC Tax City, yun talaga may mga tao. The Student Affairs Office is the one manning that. So if you think we can help you, then please do so. Get in touch with us. And again, thank you so much, Ma'am Winnie, for your time. And for everyone, to everyone, God bless and Happy New Year.
Happy New Year, ma'am. I believe that's only a wrap up. Thank you very much, everybody. Ay, picture lang po muna.
Okay.
May I request everybody to please open your video na po. Picture pa tayo.
Okay, my dear students, ay pakita nyo yung maganda yung smile. Yan. Sige, are we ready?
Okay.
Okay, let's open it up. Okay, let's smile. One, two, three, and smile. Okay, teka ha, we will go to the next group. Okay, let's smile and teka, buksan natin.
Okay, we're still waiting po.
Okay, sige. And smile. One, two, three. Okay, thank you so much.
Thank you, everybody.
Thank you so much po. Thank you.
And that ends our activity for the day. Thank you, my dear students. God bless everyone. Please stay safe.